Well, hello, friends, and welcome to another installment of Kidney Talks with the Ron and Joy Paul Kidney Center. I'm your host, Reverend Dr. Kendrick Curry of the Pennsylvania Avenue Baptist Church, and we're excited today to have a wonderful presentation in conjunction with the Minority Organ Tissue and Transplant Education Program, along with, of course, the George Washington Ron and Joy Paul Kidney Center. And I would love to bring on the wonderful co-hosts and our speaker for today. So we have Dr. Clive Callender, who is always the seasoned statesman and well-knowledge one among us, as well as Dr. Joseph Keith Melanson, who is another one of our co-hosts. Dr. Melanson is with the Ron and Joy Paul Kidney Center, and he's a lead transplant surgeon. Dr. Clive Callender is the stalwart head of MOTEP, that's the Minority Organ Tissue Transplant Education Program. And I want to welcome and introduce Dr. Amir Afhami, and he is going to share with us today from a wonderful presentation that deals with mental health challenges in a post-pandemic world. And I'm just so grateful for you, Dr. Afhami, and I just am looking forward to your presentation.
Well, I want to begin before I launch into the presentation by thanking you, Dr. Reverend Curry, and the Pennsylvania Avenue Baptist Church for hosting this very important program. I also want to thank Ms. Jennifer Arrigo, the Executive Director of our own GW Ron and Joy Paul Kidney Center, for inviting me, and of course, Dr. Melanson, the Medical Director of that program. It's a true honor for me to be associated with the program, albeit in a very, very small way as a consultant, and feel like I'm having a small part in the very important life-saving work that you all perform in our institution. I also want to thank Dr. Clive Callender for being here with us. It's an honor to be on the same panel with statesmen in our field of your caliber. So with your permission, I will start my presentation. Let me begin by saying that I have no financial relationships, conflicts of interest to report in this presentation. As many of you know, concerns about mental health and substance use have been elevated during the pandemic, this most latest COVID-19 pandemic that emerged in December of 2019. However, what some might not know is that the concerns about mental health and substance use remain elevated 3 years after the onset of COVID-19, with over 90% of US adults, based on a recent survey by the Kaiser Family Foundation, that showed that 90% of US adults believe that the country is facing a mental health crisis. The pandemic has affected the public's mental health and well-being in a variety of ways, including both through direct and indirect ways. This includes, the after effects of isolation and loneliness, financial instability, and loss of financial resources, which has had an incredibly large impact from a stressor perspective on individuals, and of course the illness itself and the grief and loss that has affected our communities, especially when caretakers have succumbed to the illness. Worry, stress, and anxiety for those who already suffer from mental illnesses have increased, and the extra pressures and barriers to accessing care have also worsened a condition of individuals that have already had premorbid or diagnosed mental illness or substance misuse struggles. Social distancing, of course, often made it more difficult to access appropriate healthcare services, including mental health services. Broadly speaking, individuals throughout the United States have seen changes in their sleep and eating patterns, difficulty falling asleep and concentrating, worsening chronic health problems, and as I mentioned before, worsening underlying mental health conditions, and increased use of substances to cope, tobacco, alcohol, and of course, illicit substances. There we go. Over the course of the pandemic, increasing numbers of adults in the United States have reported symptoms consistent with anxiety and depressive disorder in particular, with approximately 4 in 10 adults reporting these symptoms by early 2021, before declining to about 3 in 10 adults as the pandemic continued. The symptoms of anxiety and depression, which had increased, was more pronounced amongst individuals experiencing household job losses, young adults, and women. Adolescent females have also experienced increasing feelings of hopelessness and sadness as compared to their male peers. When you look at populations at risk, overall, young adults, people of color, lower income individuals, women, and individuals with disabilities have experienced and continue to experience higher rates of psychological distress as a result of this pandemic. And just to give you an idea of the enormity of the problem, 3 in 4 young adults are struggling with at least one mental health problem, such as anxiety, depressive disorder, trauma, or substance misuse disorders. While deaths due to drug overdose increased sharply across the total population in the time coinciding with the pandemic, this increase has been profound and has almost doubled amongst the adolescent population in particular. And within that group, people of color had some of the highest rates of overdose deaths. Alcohol-induced death rates also increased substantially during the pandemic and persist currently, with once again rates growing fastest among people of color and individuals living in rural areas. Both the number and rates of suicide in the United States has increased by 4% between 2020 and 2021. Sadly, after about 2 consecutive years of decline. Once again, communities of color saw some of the largest increases in death rates due to suicide as compared to their white counterparts. And within that, adolescent females saw highest rates as compared to their male peers. Let me see if one of the things that we often forget is that it's difficult to separate mental health from physical health. The brain, the seat of where mental illness emerges is connected to the rest of our body and regulates the rest of our body. And so untreated mental illness and the growth in the rates of mental illness has given rise to an increased risk of many types of health problems, particularly chronic conditions like diabetes, heart disease, stroke, and has been particularly hard for our transplant patients who are more vulnerable to these or have these comorbid chronic conditions. So looking into the future, sort of what should we be mindful of as practitioners and patients? During the pandemic, because of some of the challenges with accessing care, there were several changes made in the delivery of mental health care and substance use services, including the utilization of telehealth and expansion of school-based mental health care crisis lines, and somewhat a loosening of state-based licensing regulations to deliver care. As the public health emergency declaration around COVID comes to an end, slated for May, some of these changes will be rolled back and will possibly contribute to increasing challenges in delivering this mental health care that we need, particularly in areas where there are disparities in the number of mental health care workers in the workforce. I'm thinking of rural areas, and areas that where typically transportation is difficult, etc. So this is one of the things that we should be mindful of as the months progress. This is particularly significant. These rollbacks are particularly significant in the field of mental health care, because telehealth has remained elevated, whereas in the ambulatory setting, whereas outpatient care use by telehealth in other fields has declined in favor of inpatient visits. I wanted to end my talk. I've talked about a lot of sort of negative trends, and I wanted to make it somewhat positive and give you some recommendations on what you can do to manage this stressful, difficult situation, in this sort of pandemic world that we live in. One of the big recommendations is take breaks from watching or reading negative news stories. There's a lot of negativity outside, both sort of, whether it's health related or, with how the economy is performing, how, foreign policy challenges. So while it's good to be informed about what's going on around the world, repeatedly hearing negative stories can be traumatizing and upsetting. So consider limiting your consumption of this kind of news. Take care of yourself, eat healthy, exercise, get plenty of sleep, and give yourself a break if you feel stressed out. These methods have been shown to reduce stress and by association, reduce the occurrence of debilitating or distressing mental illnesses. Take care of your body. Meditation helps. Take deep breaths. Try to eat healthy and balanced meals. Exercise regularly. Get plenty of sleep. Avoid excessive alcohol or substance misuse as a way of coping with stress. Continue recommended treatments by your primary care doc, your healthcare provider, and make sure you're vaccinated, obviously, against COVID-19. You should always make time to do activities that you enjoy. Communities help you cope. So make sure you talk to others. You don't isolate yourself. Share your problems and feelings. And connect with your community or faith-based organizations. Okay, the community is very important to prevent the emergence of mental illness. So make sure if you're isolated, connect to your faith-based organization, get involved, make sure that you don't lose your human connections. And recognize that if you need more help, if problems persist, if you start suffering or having, your mental condition starts getting in the way of your daily functioning and your ability to enjoy daily life, remember to seek the help of a mental health professional. And, remember that help is always available. If you're thinking about suicide or self-harm, call the Suicide and Crisis Lifeline at 988 and or go to your nearest emergency room. I will stop here. Thank you very much.
Well, thank you for an exciting and informative presentation. It's exciting because we actually have numbers to begin to talk about. It's depressing to some degree because we're talking about some very challenging areas in the life of human beings, particularly with anxiety and depression. And I'm very much ask that those who are watching and listening, you have opportunity to put your questions into the chat in Facebook or on YouTube. And I encourage you to do so now because we have the experts that are with us. I would like to open this up for questions, if you don't mind, Dr. Afmani. In societies with people of color, and I can speak from the Black community standpoint, some of the first three things that you listed included take breaks, take care, and those sorts of things. How do you begin to take care when you're in a trauma-influenced context that does not allow you to even take time to breathe?
This speaks to larger systemic challenges that we face as a society, right? And the challenges that Black communities face on a daily basis. It is difficult. The answers to that, I think, is to really redress and address systemic problems. But I think there's a big role to play by faith leaders such as yourself, Reverend Dr. Curry. In an earlier iteration of my life, I worked with the State Department to establish the Iraq Mental Health Initiative, which sought to rebuild Iraq's psychiatric and behavioral health care delivery in the midst of a civil war, in the midst of the worst violence that you can imagine. And there, faith leaders started playing an incredible role in establishing that, in creating the safe spaces for individuals to ask for help and get the help they needed. And these providers, in alliance with physicians, I should say these leaders in alliance with physicians, were often on the front line of deciding, whether the individual just needed, help around life and, sort of what I like to call mechanical help with day-to-day living, or whether it was serious enough that it required a referral to a psychiatrist or a behavioral health care provider. And we started to see some changes even before the violence had ebbed. So again, I don't have all the answers. They're much smarter individuals than me thinking about solving these historic, frankly, challenges in our system, in our society. But I think going and having a community and approaching your community leaders and having a safe space to begin addressing these issues is a start.
Yeah, I totally agree with you. I think there's a clear correlation between one's faith or participation in a community of faith and the decrease in one's stress level, as well as I think trauma. I'm just wondering. I think what's underneath my question is really something that tries to get us to look at how the mental health is connected to the physical health, as you noted. And then when we're in high stress communities, trauma informed, influenced communities, then it is something that we have to deal with as people of color, Black folk in particular. It just seems like an added layer, and that added layer seems to be something that would manifest itself in the numbers that we're seeing. Numbers of suicide, the numbers of anxiety and depression, all of those things. It's often said that, in some parts of our city, when one gets a cold, the other gets the pneumonia. And I that seems to be true and borne out even in your numbers. So I want to open this up to questions from Dr. Callender and Dr. Melanson, but I would ask if you would repeat in your mind, what are some of the coping skills that are healthy that one should engage in? Dr. Ahmani, if you could just share some of those skills that you think.
Oh, so as I mentioned, definitely, you have to make time in your day to unwind. You can't go from crisis to crisis, from stressor to stressor. Community is very important. Make sure that you create a supportive community, that you don't isolate yourself. Have space to be able to talk about stressors, to be able to talk about your daily struggles. So definitely connect to your community. Avoid legal or illegal drugs.
Hey, amen.
The illegal goes without saying, but even legal ones. Look, we often use alcohol and cannabis as a way to cope. But the data shows that over time it doesn't help. So in the moment it feels okay, it feels good, maybe gets you over a hump, but then you pay a price for it, 24 hours, 48 hours later, with increased stress, with increased, anxiety and depression. So you have to be, sort of be mindful of that. Eat as well as you can. And by that, it's not quantity, but quality, right? Sleep, we found, is incredibly important in mental health, right? So make sure you're getting adequate sleep. When you sleep less than 8 hours, sort of progressively, and it's age dependent, your cortisol level, your stress hormone goes up. So that's important. It's important to eat right. It's important to exercise, and that goes hand in hand with eating healthy. Again, your production of stress hormones go up if you're overweight, if you're sedentary. So take care of yourself. And then there's sort of more active ways that you can respond, meditation, deep breaths. But let's be non-technical about it, Reverend. Prayer, right? Prayer is a form of meditation.
Yes.
You don't need a fancy schmancy yoga teacher to teach you a good reverend, and praying with him, well, it produces a lot of this. So prayer helps. And I want to reemphasize, just as your brain affects your physical health, your physical health affects your brain. So make sure you stay compliant and keep following the advice of your primary care doc. If you have a chronic illness that's being treated chronically, make sure you're taking your medications on time. Be on top of that, because if the rest of your body isn't doing well, it naturally will affect your brain and your stress level as well.
Sure. I do want Dr. Callender and Dr. Melancon to chime in, but I want to read something that speaks from this whole piece of context and speaks of somebody just crying out for coping mechanisms. It's one of our listeners has said, "My son suffers from paranoid psychosis and not able to work at this current time. I don't know what to do anymore. My son is 37 years old. He lives at home with me, and I am tired." Yeah, that expresses what you might hear in a Black community at any given point in time. Everyone's caring for everyone. Folk are tired.
The
And
caretakers are often forgotten, of course, in this narrative. We are so focused on patients, we forget caretaking. And not only caretakers of individuals with severe chronic mental illness, as this listener has kindly shared, but more and more we're taking care of elderly parents, elderly relatives. Elderly relatives in our communities taking care of young grandchildren.
That's
That
right.
is its own stressor.
That's right.
Right? They're the moral center, and it's sadly a moral center that we've too often lost during this pandemic, right? And all of this is enormous amount of stress. Coupled with that is our in general some of the challenges within our healthcare system, where access to care is difficult.
That's right.
It's expensive. There's not enough resources. Community behavioral health care had remained unchanged for decades since its first in the outpatient setting, since coming to the forefront under John F. Kennedy. And after I'd worked internationally for many years, I realized, look, I'm not going to make a big impact in my community unless I address the challenges that are going on now systemically. And one of the privileges I had was working in the Senate for a year for Senator Debbie Stabenow in Michigan, where I helped the senator for her very important legislation, the Excellence on Mental Health Act, which really created a definition for certified community behavioral health centers, and which had never, these behavioral health centers had never had a set of requirements, since they had come to fore in the era of John F. Kennedy. So we created a standard, or the senator created a standard for what they needed to deliver, and it increased funding for these behavioral health centers. Because traditionally behavioral health was always underfunded relative to sort of other fields in medicine. And this initially was an 8-state program, and the results were so incredibly good once it was deployed in 8 states that funding was significantly increased, and now it's been expanded to every state in the union. Now, this is not going to solve all our problems, but as the New York Times wrote, in October, as this program was expanded, this is one of the kinds of solutions that we need to increase access for our patients, particularly our patients who are in low resource areas.
Wow. Dr. Callender, Dr. Melancon, jump in here and help our listeners out with some wisdom from your experience.
Well, one of the things that, and I think has been an excellent presentation, and it really cuts to the chase in terms of the problems that we face. And I'm thrilled that you emphasize the importance of prayer and meditation, because
Yes.
we need to recognize that we need to spend as much time exercising and eating the proper foods as we do in prayer and meditation. One of the things, though, that I would ask you, though, what is the difference in the impact on our patients who have kidney failure, patients who are on dialysis, patients who are immunosuppressed and have received a transplant? Do the data indicate that there is a difference? Also, is there a difference between the mental health of those patients in the pandemic who are on home dialysis versus those who are on center treatments? Those are just some of the questions that I thought you might address as you try to help us solve some of the apparently unsolvable problems.
I will, just so I'm not sort of monopolizing this conversation, Dr. Mollison, do you want to weigh in? I have my thoughts, but I thought, since you're, as the medical director of the transplant unit, you have probably experienced these issues firsthand.
Yeah, it's very interesting. A great question, Dr. Callender. But I will tell you that we have seen everything change just recently, because I think finally the funding is starting to go towards this area of helping the psychiatrists and counselors deal with this upsurge in so many of these psychiatric diagnoses, primarily anxiety and depression. As an aside, before I get to your answer, I was speaking to Dr. Ackman, Jeffrey Ackman, here at GW just the other day, and he was telling me that for the first time in a very long time, here in the medical school graduating class, we just had 7 of the third-year students match into psychiatric programs. So there's an upsurge in people going into psych. And
I have to sort of mention, we actually had 14 this year, 15 last year. So we're now in the top 4 specialties.
Wow. Oh, it's even better than I thought.
Even better.
Yeah. So there you go. And so why is that happening? That's happening because the amount of money that is going towards the treatment of these patients is going up from the insurance companies and even through Medicare and Medicaid funding. So that's great news, because it tells you that the government and the insurance companies are awakening to this problem. I can tell you, just a couple of years ago, on our end, in the transplant side, we were pulling our hair out because we couldn't get people to see our patients. It just wasn't well funded. And the insurance companies would do everything not to pay for the appropriate care. So the change, the fact that there's more money available, means that it's becoming easier for these patients to get psychiatric care and counseling. And it is of the utmost importance. As I'm sure everyone well knows, we just started a liver program here at George Washington. Well, the number one reason that people are getting liver transplants is because of alcohol, which is a change from what it used to be even just a few years ago. There's a combination of reasons why. Number one is hepatitis C is being well treated with its medications. But because of what Dr. Afkhami said about what has happened in the post-pandemic world, there is a surge in alcohol and drug abuse, right? And that it's tied to psychiatric issues as well. So we're seeing more anxiety, more depression, more self-medication with marijuana, alcohol, and even other types of drugs. So what does that mean? Well, it's impacting the health of these patients in a negative way, all the way up to the point of requiring transplantation. So, Dr. Callender, I will tell you, the good news is, no, the insurance companies are now much more amenable to pay these bills in order for these patients to see psychiatrists. And they're realizing that their physical health is tied into their mental health. Most of the issues we're having, this is true in kidney transplant as well. but I can tell you, definitely liver transplant, most of the post-operative problems we're having with these people ties into psychosocial social. So this is a huge issue, and I just wanted to say to borrow one of Dr. Curry's phrases. I just wanted to say amen when you talked about not only prayer, but you have to do things that decreases the stress. And one of the things I started doing, and it wasn't volitional, but I happen to be a golfer. I have 4 sons; they're all golfers. And when the pandemic really was at its worst, the one place that was open were golf courses because it's open air. And one of the things I did with my boys, knowing that they were under the stress of dealing with all the social isolation stuff that they had to deal with, was going out to the golf course with them, and it actually allowed us to interact even more than we normally would have, because I would have just been at work. So I think that prayer, meditation, spending time doing things that you enjoy, not being pulled into more time drinking. I had a friend who owns a restaurant in Baltimore, and I remember talking to him, feeling sorry for him, saying, I know the pandemic must have really devastated your business. And he said, my profit margin actually went up because I'm selling alcohol. So the people were buying more alcohol, although they weren't coming into the restaurant, but his overhead was way lower. The government gave him money. Plus, he was selling a lot of alcohol. That was good for his bottom line, but people are drinking a lot more alcohol, and overall, that's not good. So I don't know if that answers everything you asked, Dr. Callender, but I can tell you that only recently, and I'm talking about the last year, are we seeing that it's a much easier to get these patients into treatment because the insurance companies and the government are paying the bills.
Do you know any difference between the in-center dialysis patients and the home dialysis patients?
Oh, yes. No. Yeah. So I will tell you that the home dialysis patients are doing much better. Much better. I mean, as you know, it's not only a better form of dialysis, but now some of this is selection bias. But I can tell you from a psychosocial point of view, the people that are at home doing their dialysis are doing much, much better. And I think it's part of, they're staying in the fabric of their daily lives. They are going on with everything else. A lot of these patients are still working, and just they're surrounded by their loved ones. One of the things that the patients that are in center hate is just they have to, because it's not only the 4 hours that they're on the dialysis, it's the transportation back and forth. It really wipes out a day for them, and then they just don't feel as well. As to being able to go slower with the dialysis, if it's hemodialysis at home, the fact that they can stay on the machine a little bit longer, go slower, makes them feel better. And your brain health is better when your body health is better, as Dr. Afkhami said. And then the people that do it overnight with peritoneal dialysis, again, they tend to do well. The only issues I've seen with PD patients sometimes with the overnight thing is if they're having an issue where they don't sleep as well because they have to move around. But sleep is so very important. And you and I know, Dr. Callender, that's a weakness of what we do. I mean, Dr. Curry gets a lot of sleep, but you and I, Dr. Callender, we have had to work through the middle of the night sometimes, and so that decreases the sleep. But I'm getting better at that. As I move up in my career, I'm making it where I'm getting a little bit more sleep at night.
I wish I did get so much sleep. But I did want to note that there's one person that I believe another person that needs our assistance in just talking about these issues, and it's Reverend Dr. Patricia Smith Wallace. She says, I suffer from CKD. In researching, I noted the number of individuals getting transplants is disproportionate, especially in the higher affected population. Can any of you make a comment on that? And Dr. Afkhami, if you would even speak to anything with regard to the mental health aspects of what Reverend Dr. Smith Wallace is experiencing, that'd be helpful. So all of you gentlemen, please feel free to jump in.
Well, let me start because I honestly, right before I came on this program, I was being interviewed by one of the local stations, and it was about the question that the Reverend Doctor just posed. And what I was saying, first of all, I started talking about the great Dr. Callender because this has been his life work, right? His life work has been about decreasing this disproportionate access to transplantation. And I can tell you that a big part of Dr. Callender's success has been making, at least from the deceased donor point of view, has been making access much, much more equitable. But it didn't just happen, right? So, when you talk about UNOS, when you talk about the organ transplant business, that's all of these hospitals around the country, all of these organ procurement organizations, what made them move into the direction that they needed to move was that there were adjutants. I would call Dr. Callender, in the most polite way possible, an adjutant, right? He kept agitating the situation, saying, no, year after year after year. And things have gotten a lot better. Now, that doesn't mean that they're perfect. And this is, I think, the segue to Dr. Afkhami. I'd appreciate if you could mention how people are affected mentally by discrimination, or even perceived discrimination. When you perceive that you are being discriminated against, or that your group is being discriminated against, do you find that there are patients that present with psychological stress as a result of that? Oftentimes I'm asked to speak on differences between minority groups, right? And one of the main things that I will talk about, particularly about African Americans in this country, is the psychological stress of being African American and how that is distinct even from other people with Black skin that come to this country. So I would love to hear your answer to that, Dr. Afkhami.
Absolutely. Look, the basis, if you want to envision a model for mental illness, or for that matter, the absence of mental health, it's a stress diathesis model, right? There is the biology, what you're born with, how you develop, and then there's the stressor, which comes from your environment. One of the most pernicious and corrosive stressors in our environment is the corrosive nature of racism and discrimination. And I have to add that it is a stressor that is transgenerational. It's in our American. I'm an immigrant, but I consider myself American. Obviously, in the American experience, it's a historic transgenerational stressor, meaning that the trauma of racism that your Black grandfather experienced is passed on to you, even if you're, an established individual in a progressive community, whatever you want to call it, non-racist community. It transcends generations. And given the stress diathesis model of mental illness, even if you don't experience that racism, that discrimination firsthand, you are still vulnerable to mental illness because of that familial experience, because you're coming from that narrative and that story.
Yeah, that makes a ton of sense. That's actually what I was getting at earlier. And when you mentioned structural, we have to look at the structural aspects of it. It's not a one-time occurrence. We have a continually reoccurring issue with regard to discrimination, racism, and what have you. And the system is designed such that it reinforces it. So even if you are a part of worship or have good coping skills or a community that is helpful, you still see more than anything else those things which continually reinforce the trauma. So, what do we do when I've had a great moment, right? I'm full of faith, and I've had a great time, let's say in worship, and I'm in prayer and in my meditation, and then I have to encounter something that brings me right back. It puts me in this cyclical sort of process that I can't seem to deal with. How do we unpack that? Not just the one incident, but the greater piece that we have to contend with, well, quite frankly, is structural, is systemic. We see it on television, we feel it in the grocery store, we see it when there's food insecurity, we experience it in transportation. All of the other social determinants are pointing toward structural issues of racism. And we're asking folk to deal with it. How?
You know, I would like to make a comment on that because I think there's little question that all of us who are people of color experience this every day of our lives. And the answer probably lies in a number of factors. One of the factors is really to understand that racism is part of what we're going to face forever.
Yes.
That's number one. Number two, sometimes we don't appreciate the importance of group therapy. And people like us who look like us have to be able to talk to us about our particular unique problems that aren't going to go away. Thirdly, the importance of recognizing that the King of the earth, the Prince of Peace, God, created us all as one race.
One race.
Okay. So we're all one. And so one of the things that helped me as I grew up was my faith in God and the fact that in spite of my, or because of my complexion, I could do anything I wanted to do. And so reinforcing the positivity of the fact that regardless of the system that has its own barriers, that they can all be overcome. I know that Charles Drew once said that excellence of performance transcends the inequities of time. I personally don't believe that's true, but I believe that the truth is that if we positively feel great about ourselves, that we're able to overcome even the systemic effects of racism, which is with us.
I totally agree. I believe any day, that light overcomes darkness, and when we have the King of the universe, the Creator, our God, indeed, then we have an opportunity to overcome all of that challenges us. That's how I make it day by day. And so, I would just like to see Dr. Melancon. Any other additional comments that you might have?
Yeah, no, I think I want to segue from what Dr. Callender just said for a question for our great psychiatrist, which is I think that what Dr. Callender said, to try to armor yourself against what can deal with or what can influence your mental health. We know that even in people, and I'm asking you this because I have personal experience with this, even in people that do exactly what Dr. Callender says, they can have a weak moment, and that weak moment can spiral all the way down to suicide. So the question is, in people that have these weak moments, even though they put the armor on. And I'm, like I said, I'm asking about, because I've experienced this with a loved one, someone who every day put on that armor, every day fought that fight, had a history of depression, of course, but got into that spiral and all the way down to suicide. So I was just wondering if you could comment on that, and what is really the best way that a loved one, because we knew what this person was suffering, but we couldn't save him. And the question is, what can a loved one do for a person in that situation?
Help that person thicken the armor. And how do you do that? I think knowing that that armor is vulnerable, you got to find a blacksmith to sort of build it back up again. And that blacksmith sometimes is the physician who prescribes medication, and the lows are less low. You still have ups and downs, but the lows are lower, and so you're less vulnerable to reaching those deep dark depths. The answer might be therapy, allowing the person to examine what is it about that particular experience that gets them to that level, and what they can do to cope better with that experience should it happen again. So I think in both these cases, helping individuals access that care. A lot of times there's a lot of resistance. Look, there's a lot of stigma at the end of the day about mental health care still. So I think there's a role to play for loved ones in helping destigmatize and getting the person to the care they need to rebuild that armor. There's a role for physicians who might not be in the field, either specialists like yourself or general practitioners saying, hey, I'm seeing you here in my office, I'm hearing it's not working out. And also for leaders like Reverend Dr. Curry, where you're like, look, I know that you might have certain opinions about how you're feeling, and you might think, and you have valid reasons to feel this way. I'm not invalidating your feeling, but you shouldn't get to a level where you might potentially take your life, or you're not functional, or for that matter, you're suffering in a sustained manner. There are solutions for that, evidence-based solutions. So I think there's a role to play on for everyone in this.
Yeah, there's Ms. Linda Banks that wrote, my brother is currently on HD, basically home dialysis or hemodialysis, due to losing his transplant after 15 years due to COVID. I noticed that at the dialysis center, they have dietitians, social workers, RNs, and a nephrologist. I think they need a psychologist or a psychiatrist on staff, because I see a lot of depressed people there. What are your thoughts on that?
I mean, I will hand it off to Dr. Mallinson on this. But you look, at the end of the day, you'd asked a question, Reverend Dr. Curry, earlier, or it was Dr. Callender actually. If you have a major mental illness, it's very hard to be compliant and keep to this complex regimen that that is required of a post-transplant recipient. If you have major depressive disorder, it's hard to get out of bed. It's a struggle, much less to go to your doctor's office, much less to remember to take your meds on time. So there is no question that for transplants to be successful, we need to, if there is emergent behavioral health disorder, we need to be able to address that. So in that sense, I think there certainly is an important role for the behavioral health provider.
Yeah, I would add that I think the doctors hit hit the nail on the head with the hammer, because it was something that, as a transplant surgeon, regretted also. Was I was fortunate enough, I had a Dr. John Robinson, who's a psychologist, who was available for us at our beck and call. And as a consequence, when mental health issues occurred, he would take care of them. But every transplant center isn't that fortunate, isn't that blessed. And I think the data uh, bear out what you say, and that is that the depressed patient who is under medication is better off than the depressed patient who is not on medication. And for that reason, it is important to get to the situation where people who have end-stage renal disease and transplant patients have the access to mental health professionals, and that is just not the case. And I think our observation is accurate. We do need more mental health professionals for those patients.
Yeah, and I'll just pipe in and say I totally agree with what Dr. Callender just said, and the sentiment in the question, because she's absolutely right. All of these dialysis centers have social workers, and the social workers do a really good job. But going back to what I said earlier, which is there has been a heightening of all of these problems after COVID, anxiety, depression. And so the social workers are really being overwhelmed because there was a backlog. It remains a backlog in trying to get these people that need more, that need a counselor, that need a psychiatrist, that may need psychotropic medications, right? We're seeing more and more primary care doctors writing psychotropic meds because it's hard to get these patients in to see specialists like Dr. Afkhami. So Ms. Banks, you're 100% correct. We need to do a much better job of getting these patients in to see the specialists. And like I said, it is starting to happen, but it's just starting. So she's absolutely correct. We need to do a better job. We need to get them from the dialysis units into the offices of the psychiatrists.
This is awesome. I wish we had an infinite amount of time to discuss this subject matter, but we've had a great time speaking with Dr. Afkhami, as well as Dr. Callender and Dr. Joseph Keith Melancon. Are there any additional questions that may be burning that someone would like to ask or address? Any closing statement, gentlemen?
Well, I think that Dr. Afkhami has really done a great job in terms of allowing these issues to surface. And
Absolutely.
I'd like to hear a closing comment from him.
Absolutely.
Thank you all. I will leave you with one thought. There is no health without mental health. And thank you so much for having me.
Well, we thank you, and we look forward to having you back. And this has been a blessed time, and we are just so excited about having these kidney talks with the George Washington University Ron and Joy Paul Kidney Center, MOTEP, the Pennsylvania Avenue Baptist Church, with our wonderful co-hosts, Dr. Clive Callender, Dr. Joseph Keith Melancon, and of course, our speaker of the hour and just a great presenter, Dr. Amir Afkhami. And we are just so grateful for this time being able to share. I'm your host, Reverend Dr. Kendrick Curry, and I just look forward to the next installment of Kidney Talks. So take care, be well, and have a blessed week.